Hi, my name is Dr. Robert Groysman. I am a long COVID um, treatment specialist. I'm located in Irving, Texas. I run a covidinstitute.org website as well as a Facebook group called Successful Long COVID Treatments and Success Stories. I took a bit of a hiatus on doing these videos, but I'm back now. And what I wanted to address today is off label prescribing. Now, how did this come up? This came up from um, a website page that the FDA released on ivermectin. And it said why you should not use ivermectin or high doses of ivermectin. So that created a lot of confusion for many patients and many people, and they took that to mean as you cannot take ivermectin. Period. So I wanted to go over what off-label prescribing is. What is it? What is off-label prescribing? So off-label prescribing is using a medication that is FDA approved, but using it for a different purpose, that is a different condition, a different age group, or a different dose range than what the FDA approved the drug for or the medication for. So there's a little white package insert that you will find with all prescription medication. Many people just pick it up and toss it in the trash. But this is what this label or on label, um, that little insert is what describes what the label is. It describes what dosage is allowed or approved, what age group it's approved for. It could be adults or children or elderly, and for what condition it's approved for or conditions. Um, why is this here? The off-labeling, the off-label use is to prevent manufacturers of these medications and drugs from advertising and marketing for a different dose range, for a different age group, or for different conditions that the FDA did not approve for. That's really the main goal of on label prescribing versus off label prescribing. Why use a medication off label? Well, for one thing, from the FDA standpoint, once a drug has been approved for a specific indication, that means that they've determined that the dosage and the um, patient population and the condition that's being treated with this medication is safe. Okay. Now, the FDA does not practice medicine, and it cannot go to doctors and tell them when they can prescribe off label for which conditions and for which patient groups and um, for which ages. Going through approval for an on label treatment is a very laborious and costly process. So some companies choose not to go through that and forego advertising or marketing for those additional indications that there's been proof for, that there have been evidence for, but they don't want to go through the entire process of going through FDA approval for the new indications. Um, why does off-label prescription even exist? Well, if there's no current drug approved um, to treat a particular condition, such as long COVID, then off-label prescribing is the only thing you can do. Um, Second, if you've went through all the medications that are currently approved through the FDA and there weren't benefits for the patient, and therefore you're moving on to outside the box thinking, off-label prescribing. Um, What is EUA? It stands for Emergency Use Authorization. So again, this goes towards advertising and marketing only. So that refers to manufacturers of the medications and or products that want to market or advertise about the use of their product for a particular indication. So emergency use authorization allows them to apply through kind of a fast track system, and there's been a few that have been approved for COVID and long COVID um, using this process. One would be the COVID-19 vaccine. So again, in order to market the COVID-19 vaccine, such as by manufacturers like Moderna or Pfizer, they have to first get approval through the FDA. And since the regular process would take an extremely long time, um, they use the EUA process to get approval. So vaccines is kind of um, the most common example used for this. This mechanism, the emergency use authorization, has been around since 2004. It's been used to get testing and approval in the past as well. So the first emergency use authorization that was granted was for Paxlovid, and that was granted in 2021. This was a relatively new drug that was developed by Pfizer in 2020, and it was originally meant for the Ebola virus. And since they already had this medication, and they submitted it for COVID-19 use in 2021, and it was approved. The second one again was the vaccines, and both needed to be approved at least through the EUA before it could be marketed, um, and advertised. Um, how can a medication be off-label? Well, for one thing, many people don't even realize this, but up to 20% or 1 in 5 of all prescriptions in the United States are prescribed off-label. So what makes a medication off-label? Well, as I said, a change in dose from what was approved by the FDA, um, prescription to a different age group than was approved by the FDA, treating other conditions besides the specific condition or conditions that the FDA approved, the form of the medication. So, if the medication, for instance, comes as intravenous and you administer it topically or you administer it orally or any other way that's what was approved, it's considered off-label. And lastly is compounded medications. So medications that are compounded by a compound pharmacy are considered off-label. So we've addressed the indication, the patient population, the doses, and the form, and obviously compound pharmacies. When is off-label prescribing used? Well, the top two are some population groups are not studied well. For instance, there's not that many studies that involve children or pregnant patients for obvious reasons, and the manufacturer won't do these studies, but patients still need the medication. Um, so that's one way. The second way is if there's a rare or life-threatening illness or a new condition, COVID, long COVID, and there's no FDA-approved treatments yet. So your only option is to go off-label. So let's look at some off-label medications. As I said, 1 in 5 or 20% of medications, many doctors are not even aware that they're prescribing off-label. So there's no medical necessity or rule or law that makes or has to be enforced with doctors to tell you that they're prescribing a medication off-label. Okay, basically, off-label medication is based on medical judgment of the prescriber. If your doctor feels that it's medically necessary for you, and the benefit outweighs the risk, then it is prescribed. Okay, so let's look at naltrexone as kind of the first one. Um, it's been used for a lot of different conditions. Um, Outside of just opioid reversal. For instance, erythromycin is an antibiotic. Everybody should know what it is. It can be prescribed for gastroparesis. That is a completely off-label use. It's obviously an antibiotic, not for gastroparesis. Um, Medication known as albuterol, it's used in asthma to open up bronchi, but it can also be used for hyperkalemia or high potassium to decrease that. Again, off-label use. Beta blockers have a ton of off-label uses. The biggest one is social phobia. It's being used for migraine prophylaxis and fear of public speaking. Gabapentin, um, approved for seizures, not for bipolar disorder, not for fibromyalgia, not for neuropathies, even though how many pain patients do we know are on gabapentin for neuropathies? For headaches and for restless leg syndrome. Lidocaine, it's a local anesthetic, and the patch or cream or gel has been used for postherpetic neuralgia. That's basically the pain that persists after shingles go away. Magnesium, this is a big one. I didn't even know this was off label until I looked this up. But magnesium sulfate is used to stop or slow down premature labor. This is a completely off label use. Clonidine, another big one that has a lot of off label uses. It's used for ADHD, it's used for cancer pain, it's used to reduce hot sweats, nicotine dependence, opioid withdrawal. I've been using clonidine for opioid withdrawal or to reduce the symptoms of opioid withdrawal quite a bit for migraine headaches and restless leg syndrome. How many people take Seroquel for insomnia? Again, completely off-label. Tricyclic antidepressants. Again, these are meant to be antidepressants. They're meant to treat depression. That's their on-label use. But they're also used to treat insomnia and neuropathies off-label. Again, very, very common for these medications to be used for these off-label uses. Let me see here. Let's go down to meperidine or Demerol. This one also I didn't know was off-label, but for postoperative shivering, I have been using this for a while. After surgery, if you administer a small dose of Demerol, it can help reduce or eliminate postoperative shivering. Benadryl, okay, diphenhydramine. There is no approval for insomnia, but yet it's being used for insomnia, right? Um, this is a big one too, colchicine. Um, it's a medication used for gout. However, it is the first line treatment for pericarditis. It's actually the most commonly prescribed and used for pericarditis, even though it's not approved for that. So it's off-label use. So I wanted to give you kind of guys an explanation of the kind of things that are out there. So let's talk about ivermectin, or so the elephant in the room. Now I'm going to preface this by saying I'm neither pro nor against ivermectin. I'm really looking for the truth. So the FDA webpage that was released, okay, that says why you should not use ivermectin to treat or prevent COVID-19. Well, that isn't really exactly true, is it? On the same page, the FDA says for humans, ivermectin tablets are approved at a very specific dose to treat some parasitic worms, topical, um, for head lice and skin conditions like rosacea. So it is approved to be on label for these indications. Okay, and as I mentioned earlier, once a medication has been approved for on label, a provider, a physician can prescribe it to their patient at a different dose for a different indication in a different form, um, as long as the medication has already been proven to be safe, which it has. And again, from the website page from the FDA directly. Um, Let me see here. Where is it? One of the FDA's jobs is to evaluate the data to make sure the drug is safe and effective for a particular use, which it has done. It also talks about ivermectin not receiving the emergency use authorization from the FDA. So, is it a prescription medication in humans? Yes. I will never advocate using anything that is not prescription for humans. That means it's meant for lab use, veterinary use, or a different source that is not medical grade for humans. Okay? Does ivermectin need an EUA, an Emergency Use Act, for it to be used? Is this a new product or medication? Well, we know that it's been approved by the FDA to be used for several conditions. It hasn't been approved to be used for COVID or long COVID. However, it doesn't need to be. It just would be off-label prescribing. Okay. Now you would need an EUA if the manufacturer of ivermectin wants to market it for COVID or long COVID use. But for a prescriber to prescribe it off-label, it's not necessary. Is ivermectin safe? Yes. FDA already said it's safe. Is it safe in high doses? Well, again, the answer is yes. There was a study done double blind, fairly large study that was done in Western Kenya, and they tested between zero point 0.6 milligrams per kilogram to zero point 0.8 milligrams per kilogram given orally. Now, these were tolerated very well and it was safe. They were using it for malaria at the time. Um, However, if you look at what's recommended, it's not even these kind of milligrams per doses. It's usually zero point 0.2 milligrams per kilogram to zero point 0.3 milligrams per kilogram. My point is just to point out that some of the statements on the website are false. What are the problems with off-label prescribing? So we said that 20% of medications are prescribed off-label. If a doctor prescribes it but doesn't really think it's going to be effective, so why do it? Um, if the risks of the medication outweigh the benefits. Now, insurance may not cover it for an off-label use. Okay, there are certain off-label risk because it hasn't been tested many times in certain populations. Um, it may not be supported by significant scientific evidence, and it may lead to medication errors. I hope that helps explain some information about how the FDA works and off-label prescribing and the issues with the FDA webpage and also ivermectin. Again, stay safe, and I'll be releasing some more videos soon.